Hi, my name is Sherry Phillipscomb, and we're here today to do the heart and lung assessment. We want to know that my hands are clean and washed, and we've done the health history of the patient, and he knows that anytime he feels any tenderness or discomfort, he will know. We're going to start with the posterior. We're going to start by feeling for tenderness. We're going to feel in 3 separate spots for any tenderness in the patient. Any tenderness felt? Great. Now each time I touch you, I need you to say 9-9.
9-9.
Okay, great. We're going to start now by percussing. It's just tapping my hands. Be just a little tap that you'll feel. Okay, great. Now we're going to listen to the stethoscope in the same fields with the diaphragm. We're going to ask the patient to inhale and exhale. Again, inhale, exhale. And I'm going to go throughout the steps just for testing purposes. Okay, we're going to turn to the bell, and we're going to do the same thing again. We're going to ask the patient to inhale and exhale. Inhale and exhale. And again, I'm going to go through the spots to note where I would listen for any abnormalities in the patient for testing purposes. Okay, great. Now we're going to move to the mid-scapular line, and we're going to ask the patient to inhale, and as he is inhaling, we're going to percuss until we hear dullness, and we're going to mark, and then we're going to ask the patient to exhale, and then we're going to ask the patient to inhale again, and then listen again till we hear dullness again, and we're going to mark the 2 spots, and it should be parallel. Now we're going to look for the kidney, and we're going to hit and make sure there's no pain. Was any pain noted? Okay, great. You can turn around for me. Now we're going to do the anterior. And we're going to start out with looking at the patient to make sure that his skin is pink and moist. It is warm to touch. Make sure there's no edema around the eyes. We're going to make sure there's no edema around the mouth. We're also going to ask the patient to open the mouth. We're going to make sure there's no stenosis and the buccal mucosis are pink and moist. We're going to make sure that the lips are not swollen. We're going to make sure that the head is round and symmetrical to the body along with the skull. And now we're going to percuss the front like we did the back. We're going to start by percussing. We're going to listen with the diaphragm first in the same places. Ask the patient to inhale and exhale. Inhale and exhale. And we're going to note the spots for testing purposes of where we listen for any abnormalities. And we're going to do it again with the bell. Inhale and exhale. Inhale and exhale. We're going to mark the spots for testing purposes again. Okay, and now we're going to look for tenderness. Any pain noted? No. Okay, now as I touch you again, we're going to do the 9-9. 9-9. 9-9. 9-9. Okay, great. Okay, now we're going to listen for heart tones. There's 5 heart tones. We're going to listen with the diaphragm first. attention to the apical pulse. We're going to listen again with the bell. We're going to compare the apical pulse to the carotid artery. Okay, great. Now we're going to have the patient lie down. And we're going to listen to the heart tones again. Okay, and on the heart tones, we're going to listen, and we're also going to feel first. We're also going to check the carotid pulses here too. Now we're going to listen with the diaphragm to the 5 heart tones. Make sure again, feel for the apical pulse. Again with the bell. And now we're going to have the patient roll to the side so we can hear the apical pulse.